Surgery is one option that may be recommended depending on the stage and location of the mesothelioma tumors. The goal of surgery would be to remove as much of the tumor as possible. For some localized mesotheliomas located in certain areas, complete surgical removal may be possible, which could potentially cure the cancer or at least delay its progression. Surgery carries risks like any other procedure, but it allows pathologists to confirm the diagnosis and stage the cancer, which helps guide further treatment decisions. Radiation therapy is another local treatment option that may help shrink or slow the growth of some mesothelioma tumors in pets. Like in humans, radiation works by damaging the DNA of cancer cells to kill them or stop them from dividing and spreading. It is usually delivered via an external beam directed precisely at the tumor. Multiple, low-dose treatments are typically given over several weeks. Radiation therapy works best for cancers contained to one location rather than spread throughout the body. Side effects can include skin irritation, fatigue, and other issues in normal tissues within the radiation field. Cryotherapy, also known as cryosurgery or cryoablation, uses extreme cold temperatures to destroy mesothelioma tumor tissue. A probe is inserted through small incisions directly into the tumor, and liquid nitrogen or argon gas is passed through the probe, freezing the tissue. The freezing ruptures cell membranes and causes cell death. It can be used alone or along with other treatments like surgery or radiation. Cryotherapy benefits are it can often be done as an outpatient procedure with minimal postoperative care needed. Risks include damage to surrounding normal tissues from freezing and thawing. Heat-based ablation techniques like radiofrequency ablation, RFA, can also destroy tumor tissue. A probe transmitting radio waves or alternating electric currents is placed into the tumor under image guidance like ultrasound or CT. The probe heats and destroys cancer cells through coagulation necrosis. RFA is minimally invasive, has localized effects, causes little damage to surrounding tissues, and can be used alongside other therapies. Limitations are that only a small area can be treated at once, and it works best for certain tumor types and locations. High-intensity focused ultrasound, HIFU, is an evolving targeted therapy using ultrasound waves. An external transducer focuses ultrasonic beams through intact skin to precisely heat and destroy only the targeted tumor tissue, avoiding damage to surrounding normal organs and structures. HIFU causes coagulation necrosis through heat generated from tissue absorption of ultrasound waves. It does not involve incisions or radiation exposure and is a non-invasive outpatient procedure. More research is still needed, but HIFU shows promise as an adjuvant or palliative treatment for some pet cancers. Stereotactic radiation utilizes advanced imaging and computer planning to precisely deliver high-dose radiation to tumor tissue while minimizing effects to surrounding normal tissues. This advanced form of external beam radiation therapy may enable safe delivery of higher biologically effective dose levels compared to traditional therapy. Stereotactic body radiation therapy, SBRT, or stereotactic ablative radiation therapy, SABR, are techniques for delivering stereotactic radiation in just a few highly focused treatment sessions rather than over many fractions. SBRT/SABR may yield better local tumor control rates than conventional radiation, but longer-term studies are still needed in veterinary patients. Photodynamic therapy involves giving a light-activated drug called a photosensitizing agent, which accumulates more in tumor tissue than normal cells. After an incubation period, a non-dermal laser light is delivered via a specialized light source directly to the affected area, activating the photosensitizing agent and generating reactive oxygen species that destroy cancer cells through oxidative damage. PDT has minimal invasiveness, repeated treatments are possible, and it can be used with other modalities like surgery, though light penetration depth is limited. More research is still needed on PDT's efficacy for pet mesotheliomas. Molecular targeted therapies are a newer class of drugs designed to specifically inhibit growth factor, angiogenesis, or immune checkpoint pathways driving tumor progression. Though no targeted drugs are yet FDA approved for canine or feline mesothelioma, some veterinary oncologists have tried multi-targeted tyrosine kinase inhibitors, angiogenesis inhibitors, or immune modulators in compassionate use settings. Ongoing research focuses on finding genetic aberrations driving various pet cancers that could identify new potential molecular targets. Developing targeted therapies tailored to pets will likely require collaborative clinical trials across institutions. While chemotherapy remains a mainstay first-line treatment for canine and feline mesothelioma, the above alternative interventions are sometimes recommended as part of a multimodal treatment plan for localized or recurrent disease not amenable to full surgical resection, or on a compassionate use basis when chemotherapy is declined or not tolerated. Outcomes depend on multiple factors and more research is still warranted to better define the role of newer technologies in the veterinary setting. The ultimate treatment approach should be individualized based on pet-specific attributes, tumor characteristics, owner priorities and resources available.